This is to Dr. Arushi's Dental Club. Masters.
Okay, my network was a little shaky, so we can hear you, sir. So I think you can share your screen, sir,
Okay,
now. Let's start. Let's begin the
great.
magic.
Start sharing now. Okay. All right. There you go.
Okay. Also, we can see your. We can see it.
Still, you can see the phone. You can see the phone, right?
Haji, I think you've not done the slideshow yet. I guess.
Is it better now? Better now?
Haji. Yes. Yes, sir. Yes, sir. It's better now. Great.
Better
Amazing.
now?
Yes, yes, yes.
So, should
Okay, sir. So we are ready when you are.
start the timer now because I will specific.
Okay. Okay,
Yes.
sir. All right. Let's go.
Okay. Ladies and gentlemen, brothers and sisters, my dear and lovely brothers and sisters, elder and senior and junior colleagues, here I am in front of you. Thank you very much, first of all, to Dr. Arushi for this nice concept of virtual shadowing with her concept dental club. Thank you very much, Tooth Masters. Thank you for inviting on this platform. And thank you all for coming and being a part of this process. The concept shadowing, I remember way back in when I was organization, we were supposed to shadow another senior house officer before we joined officially. Shadow in a way to learn from their experience. Probably a couple of months, weeks probably, and then after that we were on our own. So this concept, and it's a very novel concept, we really appreciate. Coming to me, this is Dr. Sumant Mishra, a pediatric dentist working in Ministry of Health, Kuwait. And I am also known by the name Aapka Dr. We have started a campaign, Aapka Dr. Bhaiya. Here in this presentation, we like to keep it simple. We start with some introduction, my introduction and the journey from where I went and my final decision currently where I'm staying, how we are doing, and my option for pediatric dentistry and daily work routine here, dentistry across the border, common problems associated with target population here, and we'll summarize it with some cases and also advice from my colleagues, and we will welcome question and answers from all of you. So introduction. Here we can see two pictures. One on the screen, left side of the screen is me in Tripura and giving oral health awareness programs to our kids there in Tripura. On the right hand side, in one of the government schools in New Delhi. The second one is Kuwaiti babies. On the left side of the screen, the babies are watching. They are watching some song so that they are psychologically prepared us as their friends, not getting scared of us. On the right hand side, I'm trying to explain the X-ray on the computer and trying to tell the little girl, 5 years of age, Kuwaiti girl, that she has to at least 2 times a day brush as per American Dental Association, and trying to acquaint it with her. So when we start the actual treatment, she don't get scared. And here the parents have taken the picture. The basic mantra in pediatric dentistry. They say, "Oladak mithal oladi" in Arabic, meaning your baby is like my own baby, and that comforts. Believe me, trust me, that comforts the parents so much that the dad, the concept here of kissing on the cheeks, the male kiss on the male cheek, and vice versa. Only female on the females only. So they get so much close with me after hearing this single line mantra. Oladak mithal oladi. Your baby is like my own baby. So here I'm trying to get acquainted with my kids, Kuwaiti kids, and here Nepali kids on the left hand and right hand both. Here we have on the left Egyptian, on the right we have Palestinian. This is Nepalese, Indonesian, Chinese. Here we have Indian baby, and on the right hand side, Syrian baby. On the left hand side, Lebanese. On the right hand side, Canadian. We're not talking about demarcating about the region, religion, or something, but we're trying to emphasize that we from different parts of the world, and I have been treating them, and I have been traveling as well all parts of the world, thinking it as like a family, as our own family, talking about Sanskrit shloka, which I learned during my 8th or 9th school class. I am Nijah Paroveti, Garna Laguchet Sam, Udar Charitanam Tu Vasudhanukam. This is mine, this is yours. This kind of counting is done by small-hearted people. For the big-hearted, Vasudha Kutumbakam, Vasudha Ev Kutumbakam. The whole world is like a family. So we have to treat all as a family, and that gives eternal satisfaction, human satisfaction for us, and also the quality of care is the best, and we feel so happiness inside. Even or dinar cannot. Talking about my journey, on the right hand side of your screen, you can see me standing with Professor Mahesh Vermaji. He was my friend, philosopher, and guide, and he was the dean of Institute of Dental Sciences. The time I graduated in 2001 and then left that college in 2004, February. Institute of Sciences. I have the memories. I went in 2016 December. I took the pictures as a memory, and I'm standing with Professor Mahesh exceptionally well, but he inspires me, and he has imbibed all the hardworking and inculcated all the things. I remember when I was in first year in prosthodontics, way back in 1998, when I entered the clinic, I was shaking. I was not comfortable. I was taking the final impression of one of my patients, and all of a sudden, the head of the department, the dean, walked in. Professor Mahesh Vermaji walked inside, and he saw me. He sensed my nervousness, and he came to me, very politely patted my shoulders, and then he told me, so at my eyes, "Your name is Sumit." I said, "Sumant, sir." "Yes, sir, my name is Sumant." He said, "Sumant, it's very easy. With his regular and with his nice smile, it's very easy." And then he continued, "One should know what to And so Professor Mahesh Verma ji, these words are still reverberate echoing in my middle ear. And I can, every time I track, I remember his master words. Sumant, everything is easy. One should know what to do and how to do. And that's what I have been doing since then. And my advice will be to my fellow colleagues to follow the same mantra of Professor Maheshwar. This is University of Helsinki. I graduated from Malanza Institute of Dental Sciences with a gold medal, and I went to University of Helsinki, which is the capital of Finland. I did my postgraduate certificate courses with honors, and then I moved to the University of London and Barcelona. Hospitals. So University of London, we were doing research in my name. And Barcelona Hospital was the hospital where we were treating patients clinically. So as part of my MClin in pediatric dentistry, masters in clinical pediatric dentistry, there I found nice who guided me in a nice way. And after my postgraduate, North Cumbria University NHS Trust and hospitals. So these on the screen on the left hand side you can see all the nurses and the receptionists and the doctors and the professor Mr. Putnam at the back with the blue scrubs. All of laughing, and we are sharing nice mood. This is the Max Fax maxillofacial surgery where I started working as an SHO senior house officer. On the right hand side of the screen, you can see me along with three more maxillofacial surgeons, and we had nice time there. And this team was known as Team A. Excellent. Later on, great. So inside systems, and the right hand side you can see my Arabic evidence. So excellent. Time with 9 minutes. The last 1 year, so I've been getting thank God, and thanks to the blessings of elders and well wishes of youngers. And here, so this is still part of my introduction going on, the Arabic brothers, and the left side and right hand side we have all the doctors from different parts of the world, from India, from Egypt, from Lebanon, and from Jordan. And this is after that. In between, I did my fellowship in laser dentistry from University of Genova, Italy, and here the graduation ceremony with the faculty members. And further on in my introduction, I can see I have been doing this one in Delhi, one of the government awareness program. As part of my volunteer activity, when I try to travel around the world. I've been to Nepal many times, and I have been to India, New Delhi, Noida, all those areas we've been checking activities. And recently we have adopted a village in Gaya, and we are trying to sort out the village and make it a role model village with an inhabitant of 1,000 people. It's a bit easy, and then we try to do the services of cleanliness there and Swachh Bharat and telemedicine and creative schools for the kids and empowering the women and trying to sort out the unemployment issues. Here I am serving, on the weekend I'm serving here one of the biggest avenues mall with our Arabic brothers and sisters. Here we made nice camp with them. And we got nice masks, and we are not wearing masks in the gatherings. So it's all pre-COVID era. And here I'm subtle talk show. On the right hand side, I'm teaching the kids brushing technique, and then they're going to do. Also, volunteer for blood donation many times and trying to make awareness about the healthy practice of blood donation, especially during the COVID time. A lot of life can be saved by simple blood donation. Apart from the basic thing that blood donation can help a mini screening of our blood, and also 5th of World Environment Day. So I'm an active environmentalist, basically climate and try to support the environment and doing so trying to raise awareness tracing and talking to them on the phone, even in the midnight, trying to calm them down and doing those questionnaire fillings for contact tracing, and trying to send the positive message through my social websites, through all my social platforms, trying to give the positive image of India, because if this pandemic has ravaged the world, and it's not only India, it's the whole world suffering, and I think even here. So no government is perfect. They're trying to analyze, they're trying to experiment, they're trying their best, and at this time they need the support from all community members, from all individuals, and we united, we right. I've tried my own little bit to project them through my social platforms. Worked as trash hero for beach cleaning campaign here many times, and make campaign about how. But we have to teach the masses, teach the society, learning and making training camps to get acquainted, and then passing it to the community, individuals as well as communities, so that they know their own responsibility as well. Here, those who keep our streets clean, these people are from Bangladesh, Nepal, and Pakistan. We owe to them as well. So we try tentatively. This all. So make them happy as part of humanity, gesture. So this is our responsibility. So trying to give back to the society part of this. And we went to Nepal before I started any campaign in Nepal. My dental campaign in Nepal, I met Honorable Health Minister Shri Gagan Kumar Thapaji. That was in 2016, December 2017, early. But now they have replaced another health minister's come. So then I started working. My first New Year's, 1st January 2017, was spent in the mountains serving these cute kids. Says all. And as we say in Arabic, Al-Amal al-Ibada, work is worship in English. Hindi में बोलते हैं कर्म की पूजा है. So this picture of eyes says it all.
My daughter really wanted
$1 million or rupees cannot give me the satisfaction whenever I see this kind of expression, smile, on the faces. And on the left hand side of the screen, you can see Professor Dr Sumant Mishra ji is thanking me. Thank you him so much for rendering free medical service, and wish him a very happy new one. This is eternal bliss. And here we met ambassador of Indonesia, And on the right hand side, we did a lot of
Want to get some pistachio
dental
ice cream?
activities with them, with their community. The Indonesian diaspora is very active here, especially with this. And I like to do cooking. So men do cook. And on the left hand side, I prepared some sweet dishes, dessert, and on this area, Kuwaiti personalities, they like to share the food. And they love to share in big amount. Like the next slide we show, like the left hand side, see the big, maybe let's say, so I will have 20, even 20 would be consideration. It was particularly, especially like 30. So they love to click it. On the right hand side, I made for myself paratha and
I can't do this.
all those things. This is what I do.
This. Return me to the
This explains what I do after my work. So all this, and also lawn, if playing lawn tennis, but mostly social services and all the things that gives me eternal satisfaction. And coming to the cases now, the simple one case, but here we are about girl who came. The parents were surprised. They were saying a new tooth is coming, and there's a white spot, and in a bit of panic. So I, when we examined it, I saw it was the fenestration. There was a sharp root of this second canine on the lower left side, canine, and deciduous canine, and this root was irritating, continuously irritating, and an ulcer on the buccal mucosa. So I tried to calm him down. We took the tooth out. And this is basically illustration. You might remember those were done for the committee already. There's the reference and there is illustration. Opening, all the roots are exposed. But here in fenestration, it's like a window. So it's like a window. So partially you can see in the tip is exposed, and the crown and tip in between, it's still covered by bone. So we took it off, and then we prescribed some healing gels, and then after we don't have the post-operative results pictures, so unfortunately the patient went to another area. But these are all, this patient was under 5, so I think 4 years of age, and cooperative, but the parents were in our field, pediatric dentistry. In our field, I say with due respect, buy one get one free, get one or get two free. So here, get our clients, kids, we don't only get them as well. I would like to emphasize, probably I should have told it earlier, why I chose pediatric dentistry. The option of pediatric dentistry was never thrust on me. Initially, from my heart, I always wanted to be a surgeon, especially when I worked in North Cambodia University NHS Trust. But I realized that if I work with my passion, family life might be compromised with due respect. And we are getting calls in the night, midnight, anytime. So the other option, the second option on priority list was pediatric dentistry. Why? Because here I knew main thing, what I love about pediatric dentistry is my passion to treat the kids. As I say, Oladak Mithal Oladi, my famous mantra, your kids is like my own baby, okay? So this passion, and with kids, I become feel like sweet 16 in my heart and my endocardium. So, and the passion when I start, in the moment I see them and I literally with excitation I greeting them, the parents many times get shocked in a positive way, as if this guy knows my baby since long. So they get impressed by this attitude, and they start talking in a friendly way, even though there's a lot of barriers, geographical barriers, religion, all but still.
Leaving you for Raphael and making you look bad in that meeting. You're right. I have no reason to trust you or help you.
As we see since here, focus about what just more about humanity, serving the humanity. So all the barriers. So that is exemplified when that's one of the issues for which I choose. We will have the control, not only the keeping of a baby, but also transferring this information, vital information to the parents and mom, dad. And with the babies, we are touching not only the baby, but also their friend circles, the school, and it's a big public health community where services we are doing. So here, when I explained, first of all, we have to calm down the nerves of the parents. And then once parents are controlled, many times the kids are controlled as well. And we have to use something like that. Like when we put composites and H prime bond, something like that, we start saying H meanings known as shampoos now. The shampoo for the tooth, blue color tooth, and to make the kids calm down their nerves, and then the parents are already briefed in advance that patients might cry, because we are treating most of the patients where I work in pediatric dentistry in specialist center, they're under 6. But some of the pictures I will show you are above 6 because I was working in school oral health program. But this case one is under 6. Let's go to case. Yes, why I have 40 years of age, presenting with class 2 of upper right, upper left, basic involvement of pulp. So it's Ellie's class 2 fracture. Class 1 only involvement fracture. Class 2 enamel plus dentine. Class 3 enamel plus dentine plus pulp. So here we are seeing upper right central incisor, upper left central incisor, upper left lateral incisor. Class 3, class 2, Ellie's class 2 fracture. So enamel plus dentine, no pulpal involvement, and with whatever shade we had, limited shades we had, we did the restoration, and you can see the upper right and upper left central incisors and upper left lateral incisor. We try to match whatever shade we got, and then
No, not silly. Distributed. This is crazy. This is hope, Miss Villanueva. This is already bringing more people to the church.
did the
Many people like you and like Saint Teresa are humble publicizing
240. This is again coming to under 6. So came with pain, night pain as well, lower right quadrant, 5 years of age, and unfortunately the X-ray is not here, and the limited, because when we work on these kids under local anesthesia, we don't have general anesthesia in Ministry of Health. The general anesthesia here is only for special needs patients. So we saw in the X-ray lower right D and lower right E were pulpitis basically, and we do pulpotomy for them. So on the right hand side of the screen you can see the pulpotomy has been done, and then
What is up with you? This case is your baby. You should be celebrating.
I'll celebrate being the intercepted drugs in Castle Restaurant.
on the right hand side of the screen you can see IRM, and on the right hand. And case number 4, we're talking about lost teeth. So when we have to remove The teeth either is like here on the upper right quadrant, this is maxillary quadrant. Upper right quadrant D has been taken off, and upper left also D has been taken off. Grossly decayed, we cannot restore them, we cannot save perpetual steel, we cannot somehow. So we took them out, and at the last visit we have to, but we don't do the anterior cells. That's the anteriors are not done in administration. That's why here you can see the anteriors still have cavities. So you can see upper right, we have placed this, what we call it, this container, to maintain the space. So that's the course comes permanent. This is intact. So what we do is take the impressions, we take the impression, and then on the right hand side you can see. But how we do it? This kind of space maintainer is known as band and loop. So here we select the adequate size, the proper size of bands from prefabricated bands, and we placed on the right E and also left E at the same time. And when we got the appropriate side, we took the impressions, and impressions were sent along with the bands. We took out the bands, we put it in the impression, alginate impression, and sent back to the lab. The lab fabricated the bands, the loops, and soldered the bands. After soldering, they gave it.
Well, I'm not supposed to.
10 minutes. And we took this and treated them. Check the bite, took the X-rays, the radiographs on the right hand side. Keep under case. So to maintain arch space is not lost. So when we take out, we have to take out some. We don't like to take the tooth. Now the emphasis is to save the tooth. So as like we say, we try to save them so that they can chew at the back, or otherwise the nutrition might be compromised. But this is always the last option. Many times we cannot save them. Either they come report to us very late, or many issues. So here, when we fabricate them, we maintain the arch, all those things, and the space. So this is the radiograph. Case 5, sorry. Case 5. Here. So here we did only after the radiographs are presented. We don't have that records as local. When we do the lower right 6, we have mesobuccal and mesolingual, and also we have 2 double canals distally. So we have to keep a lookout. We have to be sure about 2 canals in the distal. So here, luckily we did it. Unfortunately, I don't have the record of gutta percha or before that when we did it, but it was distinctly visible and it was separated. Okay, so distal canals was subdivided into distobuccal and distolingual. So here we have mesobuccal, mesolingual, distobuccal, distolingual, and you can see upright. Case as well as here, the second case number 6, we saw on the lower left 6, first permanent molar. Here also we have distinct canals distally, so distobuccal, distolingual. So these were the interesting cases, but unfortunately we didn't have things. So that's why when we do the root canal of these, we have to be sure about the, let's say, distally 2 canals, or sometimes when they are grossly decayed, we have to be careful about 2 roots distally instead of 1 single root. Okay. Otherwise. angles, girl. So talking about the cases here, oral hygiene is somehow ignored in this part of the world because of the extended family, and the babies are many times ignored, neglected, with, and especially if the parents, mom, dad are working, both of them are working, they get ignored, and we have many babies, so they cannot focus. There are some khadamas, which means housemaids, but housemaids cannot work which we give to the parents slowly setting in, but it's really, it takes a lot of efforts. On the left hand side, you can see the oral hygiene, heavy pack, and upper right as well as upper left, lateral incisors, totally fractured till almost the gum level, gingival. Here we don't have, we don't have the radiographs, unfortunately. But here, the only thing I can show you is showing you the recontouring with the posts, the upper right lateral incisors, and after that, we use the composite restoration, use the crown, and settle that, then we go repeating your series with the other kind of permanent crowns. But for the time being, this case will show the next case has those radiographs as well as the posts. So other posts with the lutein cements. So let's go to the next one, case number 8, which is probably the final now. So here we can see this another case, adult one, not under 6. So he gave all those permanent teeth. Upper right lateral incisors, Alice plastry fracture, enamel plus dentine plus pulp involvement. Then to us with on the right hand side of this, you can see the pulp extirpation was taken. You can see it came out of these cases, apical 1/3 sealed up, obturating material, and then the rest 2/3 with the post. Here we are using the fiber optic post. So you can see on the left hand side of your screen this little shadow, really lucent shadow going inside. So that is the fiber optic post, and this is post try-in. We put the post thickness of post, and we took the X-ray to see the depth and everything is gone fully or not, and then we cemented it on the right hand side with the dual curing cementing material, and then make the crown, the composite restoration. On the left hand side, we have the composite restoration, upper right side, and the right hand side of your screen, you can see, you cannot make it out somehow. The polishing has been done, but for sure it takes time. Like this one, second visit, and how, because this boy was very cooperative and not too much crying like the under 6 baby. So here we did a lot of, we could have done a lot of things. Okay, final post operative, you can see here. So you can clearly see observation on the right hand side of the screen, middle, vegetation, nice tooth structure, crown, coronal structure built up. There's no gap. So whatever limited facilities we had in the ministry, but to be honest, they have excellent things with them. And the kids, now it's up to the kids and the parents to do their homework. We have to, we always
But we won't let that happen because we'll put the baby first.
so that home care and maintenance is
I filed for divorce.
shared. So as in my case,
It used to be, but it's not anymore.
I am from a middle class family.
I want to get to
We have achieved all through hard work and patience and the support of our senior colleagues as well as professors. But hard work was the essential thing. And our faculty members in Maulana Azad Institute of Dental Sciences helped us a lot from Professor think in retrospection and reflect on that. I remember that they helped us at each and every step. Professor Singh Talwarji, Professor Tulka Tripathi, others, I cannot name many of them, all of them helped a lot. And the patients, we were blessed to have a lot of patients coming to the relevant area. And we were blessed to have nice faculty members to have taught. And we had to imbibe. While learning, we have to be like a sponge to imbibe, to absorb whatever comes our way. We have 2 ears. God has blessed us with 2 ears. And in between the 2 nervous system, brain. So we listen from, let's say, left ear, screen it, scan it, and then keep the nice things in the central nervous system. CPU. On the right hand side, there is another one. We can take that tablet. There is, because we have this, ultimately we have to get this stuff and then put in perspective. It is good, excellent, but till the time we don't apply it in our clinical practice, the tactile sensations we feel through our hands, the fingers, it will not come perfectly. So we keep practicing. Practice and practice makes a person perfect. And another thing, my journey from India to Finland, from Finland to London near Scotland, and from Scotland to Kuwait, with many things in between. Everybody.
You asked me to rap, so I'll ask for the not too hard. Let's take it slow just to start. Oh, too deep. Too deep.
Believe me, trust me, guys, and go into trust. I love recording every and hopefully till my last breath. So I advise you all to learn from them. And I realize that if we accept the world as a family, as the phrase in Sanskrit says, Vasudha Kutumbakam, Vasudha Eva Kutumbakam, the whole world is like a family. When we accept the whole world as a family, when we keep doing the end, and they will, trust me, they will accept. You won't believe it. Many times the parents get angry. For 3 years, 4 years, baby, with the basic thing, sound, air, water, clamps, and everything. And that is difficult. Tough time to make the parents understand. Make the parents understand that this crying is not because of the pain, not because of the, some of the parents say, why? And one is saying inject too much injection. One is why? Why did you give too much? Why didn't you give more? Give more anesthesia, injection. So it's a big challenge. And many times we have few cases where the on seeing the blood, let's say extraction, faints. So we and the baby starts crying more when the baby sees his or her mom fainting. So it's a real challenge. Focusing on the small mouth of a small baby, the babies are already in a state of shock. The mom that also, so it's like by one or by get by one get one or by two. We do expect but people understand the steps and all things. We have consent forms. In the consent forms, we explain all the procedures like the right issue of استخدام تخدير سطحي موضوع يعني we will use تخدير يعني تخدير سطحي topical gel and then موضوعي and then we will use the injection and then we will خلاص now we will remove the tooth if there is abscess or too much broken. So we step by step you to tell each and everything. Even the step of taking X-ray, we have to tell them before we take the X-ray, and even application of sealants, everything we have to tell them, and we have to tell them that it's like a sand, feeling of hand moving, feeling of this feels like a big bulge or my bite down. Baby, what happened? See, what did you make it? It's big, and there is yellow. You did something with the handpiece. So it's a bit challenging. Not that it's their fault, but let me see in my own, as my own fault. It's quite challenging to explain them, show them on the pictures, through the pictures, that it happens that the patients bite their lips after, because they start biting their lips, they feel weird. So when we document and when we explain each and everything ethically as well as and show them, then it makes life easy. So brothers and sisters, guys, ladies and gentlemen, in life, we have to emphasize on documentation too much to save our back, to be safe cases, and ethically we have to be perfect, close to perfection. So we will advise you guys to be there, and you will rule the world. The best advantage of India is human resource power, and we have to do human resource development, and the policymakers are watching. And this is a new world. We have to come out of our shell, of our cocoon, and we don't have to demarcate or don't have to be bowed down in a geographical barrier. We have to transcend this geographical barrier, and then the whole world is for you all guys and girls. So just follow in complex. Just accept everybody. Be nice with them and as close to perfection as possible, and following ethical treatment, medical practice as a proper communication skills, not only with the baby, but also the parents. That is more very essential, quite essential. And trust me, 90% of job will be done, because once you take the parents into confidence, they will do anything. Many times, I got off track. Many times when I talk to the parents, and then they are upset. They are upset. I let them talk. Let them talk. It comes out, catharsis comes out, and then once they're calm, they took it out. They're calm. You keep quiet. Let them take out everything. Once it's done, you explain. What I start initially was a lot of language, I went to one private institution and learned everything in 1 month. And distance between your house and your school will not serve the purpose. You have to do homework. You have to learn and read at home. And especially during the summer vacations, Dad used to make us teach or finish all the subjects so that when we start again after summer vacations, we we will be literally revising with the, with the teachers. So my dad always says, with teachers, teachers can only guide you. They don't have anything like freedom of thought, they can't and give it to you so that you learn fast. No, they only can guide you. The homework has to be done by you. And that's what still echoes in my ear. And as for visual mental saying, anything you can do, you must conquer the world in a nice way. And love begets love, respect begets respect. Love the world, respect the world will kiss you on the side as they the parents were angry. But when I say one single line, or other misal auladi, your baby is like my own baby. Wow! They start kissing and hugging and okay, doctor, sabi aishe. Hada auladaka. Do anything. This is your baby. So in pediatric dentistry, we can make
Mama, ruko, wait.
Thank you so much, sir. Thank you so much, sir.
It was an amazing session, sir. So we learned a lot. So we have a few questions in the chat. Wait, I'll let you know. If we go on the meeting, ongoing meeting, ongoing call. Yes. And now you can turn your video on. Yes. Yes, sir. Now we can see you. Sir, yes, sir. Sir, we have a few questions in the chat. So Shruti is asking, what advice would you give to your undergraduate self? Next question is, sir, can you please tell us what should we advise the breastfeeding mothers so that they can prevent dental caries in their babies?
bottle, baby bottles being used. So then pure water. The main thing, when it's a should go, they have at the end they need to wipe or wash or brush nicely so that is remove the remove the remnants of the milk.
Yes, sir. Yes, sir. Yes, sir. Okay, so another question is, how can we pursue post-graduation studies?
Yes, doctor. Yeah, interesting question. We have some international postgraduate courses. I went for master's program, but because I got acceptance in Queen Mary University London for clinical, so I converted that master's program to what we call as postgraduate certificate courses. So leadership qualities, something like that. Master's in clinical leadership courses in University of Helsinki. And believe me, they are very nice. At that time, I'm talking about 2004. The honesty rate was 98%. Now, and it was excellent. They were very nice. Protocol have changed, and every year it's a bit strict. But you have the requirement, and once you see the requirement, the main thing is a good statement of purpose, SOP, and good recommendations in the course. Records. So it's that's the plan.
Yes, sir, that answers it. So next question is, Sir Godwin saying, hello sir, amazing presentation, congratulations. Can you tell what's the norm in Kuwait with regards to starting a cleaning gum pad? In India, pediatricians at village level do not allow any such cleanings. In infants till 1 year. He's asking what is real estate honey.
Yeah, tell me complete, Dr. Shiji.
No, 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 sir, go on, go on.
Yes, very interesting point he raised. Sensory as well as of the mouth as well as makes them when the teeth starts coming out, the kids are already ready to accept the mouth, the brushing, the oral hygiene. They are they accept it easily. In the same way, since birth they are given nice bath. If they're given bath, then they grow up. They readily accept it as routine daily activities. In the same way, we have seen many parents go for brushing. They are not brushing. So it has to be completed. Very good point, Dr. Sumant, you raised. It has to be done since baby is born. It has to be simple basic so that they get used to simple otherwise it will be a lot of basic so that they get and the cheek everywhere and keep examining them for any God forbid anything any abnormal thing like you said inspections since big yes
Yes, sir.
somehow I'm not able to read the messages so please Dr. Shiji if you convey so
Yes, sir, so
I'm not able to read the
okay, okay,
messages
yes.
simply
So,
okay okay
Sunny is asking, sir, what is the procedure to go to Kuwait after graduation?
so to be honest after graduation Kuwait government has recently released national graduate card because of their graduates. So every graduates delegation graduation who are born expatriates who have born here in previously. So still they still recruiting, and just not pediatric dentists, but recruiting. So recruiting is doing well still for the masters, but for the video quality, it started getting a bit challenging because they have bored here and the 3 years experience after 3 years, they will become bored plus education here till 4th level. That is the challenge. But I think in Dubai and all those areas, Abu Dhabi, other areas, I think it's not there. So that can be an option. Probably the salary will be challenging, but step by step, people will save them most of the time because
She's asking him the teeth start erupting. What advice should you give? And which toothpaste or toothbrush should you advise to infants and toddlers? And she's also asking if you can tell about some articles that will talk about the same.
okay. So normally I go to ADA website, American Dental Association websites. Talking about that will clarify the brushing technique, the forest and the what toothbrush is, and what ADA requires from American Dental Association. So that twice brushing twice a day, and fluoridated toothpaste. So the question comes from there. And minimum twice a day with fluoridated toothpaste and minimum 2 minutes. That's the thing. And yeah, sure. The soonest I would recommend the soonest starts erupting, I start recommending the brushing. Before that, gum patch training, Dr. Garaj will recommend it. And later on, they can start changing. And we recommend size of rice. चावल दे देने के लिए. That's it. But still, having said that, PPMs are decided by the high risk, medium risk, moderate, and low risk as well. So individually, it cannot generalize. It has to be tailored individually as well. But generally speaking, it should be done like this. The IF especially provides soft toothbrushes at least twice a day.
So I think this. So we have a question from Priyanka. She's saying, how do you balance your study and personal life through the UG and further studies?
So the last step, how do you balance your personal
Study
and
and
professional life?
personal life.
After that, I'll disconnect.
Study and personal life during your UG times and when you did your further studies.
So that's why we made a nice constructed group because we had personal things as well. So in this limited time when we study, we have to do smart studies. Okay, and this smart study we have to have a after discussing them for half an hour, we make a schedule, maybe twice a week or once a week, whatever suits your schedule, and that helps a lot. Trust me, that helps a lot. So 2 minds, 3 minds, 4 minds are better than one single. Okay, single I have 24 hours. Out of the 24, let's say we are working on 8 hours consecutively. So we have hours left, and then other things, activities, and everything. So you can do smart reading, and question banks helps as well, because many of the questions are repeated, and with questions sometimes I used to do let's say question bank is talking about hepatitis E. So I go and read all the hepatitis, and the next time it will be asking question about hepatitis B, let's say. So it's already covered. So that gives, and many of the questions are repeated. So be smart reading with colleagues, with constructive groups, and sharing of the question bank can be very beneficial in your working, in your family, in your personal profession.
Yes, sir. Okay, so we'll take one more question for the last question for the evening, sir. So, Gaurav is saying probably they will.
So what complex I wrote the complex details of reading or being with the doctor. I don't know. I didn't realize what was. So what was the
So,
complete question?
Gaurav, if you're asked, you can please unmute
Complete
yourself.
question. Yeah, yeah, better. That will be better. Dr. Gaurav, unmute कीजिए. Yes, Dr. Mishra, Dr. Gaurav, yeah, you are audible. Better. Yeah, in between is disconnected. In between, but continue. I think long sentence will hear. This is very question, but I was not aware about the pediatrician field. Nothing has entered. Not nothing, but we have noticed evidences everywhere. About cinemas, advantages, being correct. You can start the question. So this is consistent. Yeah, you're right. It's a bit challenging when you go to committee, but if I were to be you, I will keep continuing with that and trying to convince in a polite and nicely convincing way with the evidences rather than turning into confrontation. This is very important issue, and I am confident this is in the past as well. So, Gaurav, you're doing excellent job. Keep continuing this job. Try to support research work you're doing, explain nuclear things, show them nicely. They are aware nowadays. The consumers are more empowered and they are aware as well. They talk with you. Maybe they will listen to you or some printed version with figures, like they see images, figures speak 1,000 words.
Yes, sir. Yes, sir. I heard the answers. Sir, I think we'll call it a night, sir. Thank you so much for coming with us. Thank you so much for giving your time. It was really
Presentation, sir. We learned so much. So thank you so much.
Thank you very much, Dr. Arushi, and your dental club as well as Masters. And thank you all, my dear brothers and sisters, my fellow colleagues, junior and senior colleagues, and my all the prospective candidates, and all the best. Good luck for you and your future. Even Dr. Arushi ji, you are doing excellent job. Platform united everybody. And thank you very much, all of
thanks,
you.
sir.